This video will be discussing behavior therapy. And just a quick note before we get into behavior therapy, a lot of the same principles and techniques that apply to behavior therapy are going to be discussed in cognitive behavior therapy. So behavior therapy really existed first, and cognitive behavior therapy really grew out of behavior therapy through inclusion of concepts of cognitive psychology, right? So I mean, a lot of people, in all honesty, it's probably not necessary anymore, except from a historical perspective, to differentiate between behavior therapy and cognitive behavior therapy. But textbooks still split the two to be different, so we'll approach those topics differently. And I guess it's important too to understand with depth the individual principles with regard to behavior therapy before getting into cognitive behavior therapy. Okay. So really two theories that are important to understand before getting into different approaches of behavior therapy are classical and operant conditioning. And there are like a variety of videos out there on YouTube, multiple or in my playlist, that show examples of classical conditioning versus operant conditioning. And in my experience, people really get the two confused pretty easily. So let's try to differentiate between the two first and then go to each one individually to take a look at them, of all the pieces that go into each. So classical conditioning deals with impulses. All right, where operant conditioning deals with learned behavior and choices. So in classical conditioning, we have impulses and reflexes, and in operant conditioning, we have learned behavior and decisions and choices. All right, so we'll get into classical conditioning first. The most famous example is the Pavlov dog experiment, right, where a dog was provided with meat. And then when the dog saw that unconditioned stimulus, the meat, the dog had an unconditioned response, something that naturally exists in that dog's brain, and that's the salivation response, right? So the unconditioned stimulus would have been the meat, and the unconditioned response would have been the salivation. So every time the dog was presented with meat, a bell rang, right? Present with meat, salivate, bell rang, and that's repeated over time. Eventually what happens is that just by ringing the bell, the dog can have the conditioned response of salivation, and the conditioned stimulus there would be the ringing bell, right? We pair a conditioned stimulus with an unconditioned stimulus to give that new conditioned stimulus new meaning, right? And that would lead to the salivation response of the dog. So anytime we're talking about conditioning, we're talking about learning. All right, and you can see in that example with classical conditioning that we're talking about a reflexive behavior, right? Salivation. I mean, and we get this stuff all the time, right? Classical conditioning plays a significant role in all of our lives. Certain songs remind us of things, right? And that's not really operant conditioning with regard to choices, right? But that conditioned stimulus was tied to an event that takes us back there and reminds us of that thing. For example, I like to eat cereal, and I eat cereal about 10 o'clock, and a specific television show comes on television at 10 o'clock on weeknights, right? So even if I'm not hungry, right, that television show comes on, and I get the reflex and the impulse to want to eat, the desire to eat, right? I begin to be a little bit hungry, and that would be a process of classical conditioning. And that's really important to understand. If we look at people with a history of abuse, and a lot of the abuse work that I do, a lot of kids, if they're assaulted at a young age, it happens repeatedly over time. So certain things in my experience that can be paired with that unconditioned stimulus of right, being assaulted in the fear response, certain conditioned stimuli can be paired with that, such as cologne, music, time of day, sounds, footsteps. I mean, really textures, a particular voice, a man's voice or a woman's voice. I mean, so the options, they're really limitless. And that's really an important concept when doing abuse counseling, right? To help the client, and this is in drug and alcohol, and everything, right? We can go down the drug and alcohol examples for a long time, right? If I get high listening to a specific song over and over again, eventually that song is going to come on when I'm trying to be clean, and I'm going to have that conditioned response of wanting to get high, and possibly the behavior of wanting to get high, right? And that's an important process to help clients understand. It helps really demystify that process of understanding why these triggers in my environment are causing me discomfort, urges, fear, panic, whatever it might be. And not to be confusing that with operant conditioning, right? Classical conditioning, say it over and over again, we're talking about reflexes and impulses, and in operant conditioning, we're talking about learned behavior, right? So this gets a little bit tricky to do this. So I'll do my best to not confuse you in walking through all this stuff verbally, because there are a lot of moving pieces for people to really take on that can get confusing very quickly. So in operant conditioning, we're talking about learned behavior such as choices and decisions. So again, conditioning refers to that learning that occurs, and the operant is the target behavior, right? Conditioning, the learning that occurs, and the operant is the behavior that we're focusing on. Okay, so I guess we'll start with positive and negative, all right, and just understand what those things mean. So anytime we're talking about positive, we're adding something. Anytime we're talking about negative, we're removing something. All right. So then we have positive and negative, and then we have reinforcement and punishment, two separate concepts to understand. When a behavior is reinforced, that means we are increasing the likelihood that that behavior will occur again. When a behavior is punished, we're trying to decrease the likelihood that that behavior will happen again. And each of those, reinforcements and punishments, can be positive or negative. All right. So in a positive reinforcement, we are adding something pleasurable, possibly Snickers, right? Snicker therapy, because that's so effective. But this is in token economies and a variety of other things, or even just those verbal strokes that we give somebody saying, good job, you did fantastic. We're adding something that's pleasurable to the equation to be able to increase the likelihood that that behavior will occur again. In negative reinforcement, we are removing something that is aversive. Right? So like maybe a bedtime or a restriction that exists. We're going to remove that in order to increase the likelihood that that behavior will continue to occur, right? So if I have a 10 o'clock bedtime, which actually I have a 10:30 bedtime, so we'll go with that. If I do good during the day, I get all my work done, there might be some negative reinforcement, and they'll remove that bedtime restriction from me. So I guess semantics can be a little bit tricky with regard to understanding the positives and negatives with regard to reinforcement. All right, so then we have punishment. A positive punishment would be adding something aversive. So like every time a student misbehaves or gets something wrong in class, I spray them with a water bottle, right? And that would be adding something aversive to decrease the likelihood that that behavior will occur again. That would be a positive punishment. In a negative punishment, we'd be removing something pleasurable. So maybe if somebody removes my television, that would be a negative punishment. All right, you're removing something pleasurable. All right, so those are important concepts to understand, and they're widely used today within specifically residential facilities with regard to setting up levels and token economies, right, to be able to encourage youth to demonstrate positive behavior. Although we could talk for a very long time about the reason that that's ineffective on a broad level, but that's outside the scope of this video, I suppose. And finally, the last behavioral approach we'll talk about is the work of Bandura and social learning theory. And that posits that we learn by watching others. So very specifically, very simply, because there's other concepts we're not going to get into with regard to self-efficacy and all of that. We have models and imitators, right? That we look at other people to start to allow them to model behavior for us, and then we imitate that behavior. And there's evidence that this occurs within us within the very first few weeks of life, and this is very important during infancy with regard to learning, right? When you make facial expressions like I do, and you have a 10-month-old infant at home, it's kind of shocking, and people get a kick out of it that she tends to mimic most of my faces towards other people, which oftentimes aren't necessarily the most pleasant faces. But that's a side note, right? So we have the model, the person who's demonstrating the behavior, and the person who's imitating the behavior, and that's built off the principle of vicarious learning. And that's really important, especially when we grow up and we're more cognitive beings through adolescence. We have models that exist throughout the community, right? Through the media, the music that we listen to, the role models in our life. It could be athletic teams and teachers. I mean, really, it's limitless and is based on the individual, but it's really important to keep that in mind where we learn these behaviors. Right, and that's supported by research. Children who have parents that are divorced, are more likely to be divorced themselves, right? We start to develop working models of how people interact with each other and what it is meant to be. So in behavior theory and behavior therapy in general, we're talking about specific clinical procedures that are primarily built off of the theories that we just discussed. It's very action-oriented, it's very goal-oriented to be able to decrease the number of panic attacks. So it's important when you're using behavior therapy to either use assessments, probably assessments, and create measurable, observable, and objective goals. So we understand if we're getting closer to those goals, or the interventions that we're using are not really being effective. With that being said, I think it's easy for people, and I do a lot of behavior therapy under the guise of cognitive behavior therapies in my current practice with people, specifically with desensitization training, which we'll talk about here in a little bit. So there's this kind of like misconception that to do behavior therapy with a client that you don't have to have as much of a relationship. And I think that could be true with some people, but again, the relationship is really the foundation for a lot of these interventions, because a lot of the interventions are going to be very uncomfortable at first for the client, especially when we're starting to teach relaxation training and whatnot. So it's really important to have that relationship to be able to build on that. So within behavior therapy, we have what is known as the functional behavior analysis. All right, and that is the ABC model. So don't get the ABCs of behavior therapy confused with the ABCs of cognitive behavior therapy, because in counseling and the helping profession in general, we just love the heck out of our acronyms. So obviously ABC is going to be a popular one and come up a couple times. So the ABCs of behavior therapy are antecedent, behavior, and consequence. And it's a way that we can look at specific behaviors and start to determine what's causing that behavior, define the behavior, and look at some of the consequences. So antecedent is what occurs directly before the behavior. All right, and then the behavior is the operant, the behavior that the individual is demonstrating, and then the consequence is what happens immediately after the behavior, and what payoff does this serve. So I'll give you an example that's common in working in some alternative classrooms and whatnot with students. Let's say we have some younger students and they're circling up to start reading. Every time Tom, when we start to read, he starts to make some comments, starts to act up, and then eventually he gets very aggressive. So the antecedent would be we circled up for reading group, and then the behavior would be Tom starts to misbehave, act up, and the consequence is he gets sent out of the classroom and has to sit in school suspension, in school detention, and is no longer able to participate in that class for the day. Now, what possibly could that functional behavior analysis help us do in that situation? So we circle up. Tom starts to act up, and then he's removed from the classroom. Right, so that's the way that we're dealing with that behavior, is removing him from the classroom. But if we would look a little bit deeper at Tom and see that he has difficulty reading, then we might see that that removal from the classroom would be a negative reinforcement for that behavior, right? We are removing something aversive from the equation, the embarrassment of not being able to read. So we're reinforcing that behavior, and we're encouraging that behavior to persist. And that's really important because we really start to look at how we are encouraging behaviors and what behaviors really mean, instead of like looking at them as a Neanderthal and just getting really irritated with Tom, because that's probably going to approach how we approach Tom in a different way therapeutically. Okay, so we also use reinforcements to be able to encourage other behaviors, right? Encourage learned behaviors. So within that operant conditioning, what's important to understand is that reinforcement is typically going to be more effective than punishment. All right, when we're reinforcing a behavior, we are legit teaching a new behavior and encouraging a new behavior to exist for that individual. When we are punishing a behavior, all we are doing is being subtractive. We're saying no. You should never ask somebody to eliminate or reduce a behavior unless you're able to offer that individual an alternative behavior. And that exists with aggressive behaviors. That principle is true with addiction, that we are looking for relatively healthy, right? There's a difference between the ideal behavior and what I'm willing to accept as a replacement behavior. But that's what we want to aim for with clients, is really starting to get to those effective replacement behaviors, so we can start being additive for the individual, right? And not just be subtractive from the individual. So these principles in real life, within the therapy session, they go under a variety of different ways, one of which is relaxation training. There are tons of MP3s and YouTube videos out there that teach people progressive relaxation training. Right? Part of my stress response is tensing up. That might be my conditioned response to an incident that's occurring. So progressive relaxation training tries to counteract that by teaching somebody to clench their fists, release their fists, clench their fists, release their fists, and a variety of other different things to be able to teach that relaxation process. Then we have systematic desensitization. That we develop a hierarchy, and we use relaxation training and really gradually expose individuals to some of the conditioned stimuli that might be causing some of their distress. Because if we repeat a conditioned stimulus over and over again, and we never pair it with that unconditioned stimulus, eventually that conditioned stimulus wears off and extinction occurs. And then we have exposure therapy. We have in vivo desensitization, and then we have imaginal desensitization. So in vivo desensitization, right now, I hope you understand we're targeting classical conditioning. We are really briefly exposing people to live in the actual fear situation or stimulus that exists that creates that anxiety or that fear response. In imaginal desensitization, we are using the imagination to be able to invoke that stimulus, imagine the event, possibly like imagine yourself going into a room of crowded people when you have social anxiety, to imagine it to start to get the anxiety. What I recommend with individuals when practicing some of these behavior therapy techniques is that we spend a lot of time with mindfulness training and relaxation training on the front end, so it's not so painful when we start to desensitize people to some of those conditioned stimuli that exist. Right. So there are a variety of behavior therapies. This video is just meant to give people a general understanding of the basic principles upon which they are built. So I mean, some of the strengths from a diversity perspective is that these theories and therapies within behavior therapy are easy to operationalize. So that means that they're easy to research and to say that they're effective and evidence-based, that they're relatively systematic, right? That you can have some training and then even get extra certifications and then pick up a manualized approach to start desensitizing people and using behavior therapy either through mindfulness-based stress reduction, acceptance and commitment therapy, social skills training, assertiveness training, a variety of different things, right? So it's pretty helpful to have directions and really strict and objective guiding principles to be able to conduct some of these interventions. With that being said, that's also a bit of a drawback of behavior therapies. That many would argue that it just narrowly treats specific behaviors and symptoms. It never really gets to maybe a core belief that exists, right? With individuals with a history of assault in their past, it's great to help them get over some of their fears that they have, but at the same time, there's a very strong likelihood that their core beliefs inside have been tweaked a little bit based on the events, and it's important to get in there and help challenge some of those cognitions. Right? Behavior therapy requires a lot of assessment that goes into it. It's easy to treatment plan. These are all really positive things about it, right? But the relationship can be really de-emphasized in a behavior therapy approach, and that's important for the counselor to understand, right? If I see 8 clients a day, I mean, it's very easy for me to start to approach that in a mechanical way and stop seeing that person as an individual and start being more holistic with the individual. But with that being said, behavioral principles are principles that I use. I don't want to say in every session, but they're really frequently used. I'm sure a session goes by where I don't use one, but I'm sure to try to include some behavioral methods with all of my clients, specifically with mindfulness-based stress reduction and relaxation training, and really teaching distraction techniques and a variety of other things that help the individual get their focus off of the stimulus that's causing them distress in their life. So I'd really encourage everyone, to start really studying some of the behavioral therapy approaches and really start to incorporate them into practice.